Hi there, I'm Dr. Aygün Musayeva, a pediatric endocrinologist. Today I want to talk about something every patient should know, a rare but serious condition called medullary thyroid cancer or MTC. Especially when it's part of something called MEN2 syndrome, it's very important. This video is for families who may be facing a new diagnosis or who just want to understand how early action can truly save lives. MTC is different from other types of thyroid cancer. It doesn't come from usual hormone-making cells. It comes from C cells, which make a different hormone called calcitonin. Here's a key point. If not treated, this cancer can spread and eventually be fatal. And unlike most thyroid cancers, MTC cannot be treated with radioactive iodine. Surgery is the main treatment. Medullary thyroid cancer can occur either sporadically or as part of a genetic condition called multiple endocrine neoplasia 2 or MEN2 syndrome. There are two types of multiple endocrine neoplasia 2 syndrome. MEN2A involves MTC, adrenal gland tumors, pheochromostomas, and sometimes overactive parathyroid glands, hyperparathyroidism, which can raise calcium levels. Almost everyone with multiple endocrine neoplasia type 2A develops medullary thyroid cancer, but only half of them develop pheochromostomas, which causes high blood pressure. But some people with multiple endocrine neoplasia type 2A may also develop overactive parathyroid glands, which leads to high calcium levels in the blood, a condition called hypercalcemia. In many cases, kidney stones are the only noticeable symptoms of the hypercalcemia and thus hyperparathyroidism. Some may even get a rare itchy skin condition called cutaneous lichen amyloidosis or bowel problems like Hirschsprung disease. MEN2B, this one is more aggressive and starts earlier. It also involves fast-growing MTC, adrenal tumors, pheochromostomas, and nerve tumors, neuromas, that look like small bumps on the lips, tongue, eyelids, or even the eyes. Also affects the digestive tract, leading to megacolon, a condition where parts of the colon become abnormally dilated. This can cause symptoms such as constipation or diarrhea. Many of these children look very tall and thin with flexible joints, a bit like Marfan syndrome. Here's the most important message. If a parent or a family member have MEN2A or MEN2B syndrome, they should listen to this video very closely. If a person have multiple endocrine neoplasia type 2 syndrome, their children may have this red gene mutation that they all should be checked throughout family, and their children should be monitored until they're 5-year-old if they have red gene mutation positive. Or if they have MEN2B syndrome, their children required prophylactic steroid surgery even at the 6 months old, even without red gene mutation positive, even without red gene mutation examined, because it's very aggressive. After prophylactic thyroid surgery, children will need to take thyroid hormone replacement every day for life. And that's totally manageable. But if cancer has already spread, other treatments like target medications or chemotherapy might be added to help control it. But the earlier we act, the better the outcome. Here are the key take-home messages. MTC can be prevented in high-risk children with early surgery. MEN2A and MEN2B are genetic syndromes caused by mutations in the red gene. MEN2B starts earlier and spreads very faster and aggressively. And it cannot be treated with radioactive iodine like in other thyroid cancers. The only treatment method is surgery. Therefore, if you have or your family member have this issue, your children and all the family members should be checked. MEN2A and MEN2B syndromes all have MTC, and sometimes they also have pheochromostomas and the other cancers that I talked about earlier.